Subcommittee on Health will now come to order. As a 24-year Army veteran, I've seen firsthand the struggles that many service members and veterans face in light of their service, which is why I'm excited about this first House Committee on Veterans Affairs hearing on the potential for psychedelic-assisted therapy treatments in the emerging battle against suicide, or as we like to say, emerging therapies or breakthrough therapies. I'd also like to say that as a physician who practices traditional medicine, I never thought I would enter Congress to be then advocating for emerging breakthrough therapy, but I think the science is leading the way. The VA dedicates a considerable amount of its budget and resources in pursuit of evidence-based treatments for veterans who suffer from post-traumatic stress disorder and other cognitive disorders. For many veterans, this treatment is life-saving, but more work needs to be done. It is a sad reality that close to 17 veterans per day will lose their lives to suicide. One life lost to suicide is one too many, and our fight must continue. Psychedelic-assisted therapy is a groundbreaking clinical procedure that has the potential to transform the way we look at mental health care. A licensed clinician carefully examines a veteran prior to administering a dose of a compound, such as MDMA or psilocybin. A veteran must go through 2 or 3 sessions during which intense psychotherapy is overseen by a licensed medical professional assisting the veteran throughout the experience. These sessions last about 8 hours, the full duration of the drug's effects. Based on the most recent clinical trials, patients experience positive therapeutic responses, resulting in a reduction of their symptoms, if not remission altogether. The fight against suicide and substance abuse goes hand in hand, as substance use disorder can lead to higher suicide rates among veterans. Therefore, we can't be afraid to explore new treatment methods, especially the ones that we will hear about today, that have proven to transform veterans' lives and are done in a clinical and a scientific manner. Still, we must argue and urge caution when speaking on this topic. We are not advocating for the legalization or the casual use of psychedelics. What we are discussing is the clinically administered dosage of these substances in combination with targeted therapy sessions in a clinical setting. I look forward to hearing more about the process and progress that the VA and our private healthcare partners are making in advancing what could be a new way of treating the debilitating mental health conditions that affect our veteran community. I'd like to hear what next steps are anticipated, as well as what challenges, including bureaucratic barriers, safety concerns, workforce, and others that should be addressed in moving forward. I'm also looking forward to hearing from our second panel on the positive personal impact this therapy option has had on their lives and in successfully treating their PTSD. I want to reiterate, we are not advocating for the legalization or casual use of psychedelics, but rather the advancement of science, of their medicinal properties in a clinical setting with assisted therapy. Thank you all for being here, and I look forward to our discussion and hearing the multiple perspectives based on the incredible expertise present today on both panels to discuss this important topic. With that, I yield to Ranking Member Brownlee for her opening statement.